Thank you so much for the invitation. It's like music is there. And this is an IOL which has been implanted upside down. Now here you need to instill viscoelastic. You need to flip the IOL. And once this is done, you need to bring the haptics in the normal configuration. And this becomes an embarrassing situation. And when the IOL sarcastically says, "Namaste, doctor, for implanting me upside down." So here I showcase the Bhargava Hydroimplantation Irrigator. This is basically similar to the bimanual irrigator, but with enhanced ergonomics. The features are, it's a full titanium instrument. It stopped? The video has stopped? It has a better grip. This is some amount of music also, please you turn it on. It has a better grip. It has a longer tube. See? It has a better grip, a longer tube. See, you're skipping it, please. Could you please replay it?
फिर से लगा दीजिए, फिर से लगा दीजिए.
I think that part went fast forward.
स्टॉप करके फिर से प्ले कर दीजिए.
Okay, I'll do it from here, right. Correct, there was some glitch. So here I showcase the Bhargava Hydroimplantation Irrigator. So it's a full titanium instrument and it has better ergonomics, the key features of which are it has a better grip, a longer tube, it's more sturdy than the routine one, and it has a gentle MST curve. Moreover, it's spatulated at the end. It has a spatula with a spoon-like end. Now the difference between a routine irrigator and this irrigator is that the flow is directed downwards, and this is in stark contrast to the bidirectional flow of your routine irrigator. Now this bidirectional flow is creating turbulence into the anterior chamber vis-a-vis this one. Now as you can see, the posterior flow continuously lavages the posterior capsule, and any cortical elements attached to the posterior capsule are easily flushed away. Because of the longer reach and the posterior flow, it acts like a second arm. See here, it's behaving like a globe fixator. Your eye is very stable in the primary position, and its extension is beyond the optic haptic junction. So it's helping you guide the lens into the capsular bag in its entirety. So most of your cases, both haptics will go into the capsular bag simultaneously. And since visco is not used, all that is required after implantation is you hydro-stitch the side port, you hydro-stitch the main port, and the reassuring aliquot of moxifloxacin, and that brings you to the end of surgery. So this is definitely, it has more safer, efficient and faster. And since you're not instilling viscoelastic and you're not removing the same viscoelastic, so all the complications and the time required are obviously of the beneficial part. Now here again, going beyond this, I'd like to share some tough and tricky situations where it's useful. We all know that in hard cataracts, we might encounter retained nuclear fragments which just pop up from behind the iris. And since it's spatulated, it's sturdy, it can easily be used as a crusher, and your nuclear fragment can be crushed easily and fed into the aspiration port. Now here are two cases where IOLs are misbehaving. The haptics get everted and an IOL flip is inevitable. Here again, because of the maintenance of the chamber and the solid design, and its extension from almost limbus to limbus, you can easily orient these lenses and then reposition the haptics into the capsular bag. Now, it's very helpful in small pupil, especially with IFIS. We all know that in small pupil, if you use viscoelastic, it's going to be tedious to remove the viscoelastic from behind the IOL. And since here no visco is being used, the pupil is small, so that step is negated, and your IOP surge post surgery is also negligible. Here all you need to is dial the lens into the capsular bag with no viscoelastic behind it. It's very helpful, like Dr. Harbans also talked about it, in toric IOL implantations. Here, we all know refractive surprises do occur because of retained viscoelastic beneath the IOL. So since we are implanting the lens, one more thing, the benefit is you don't need to keep it 20 degrees short. You can implant it directly in that position, and your axis marks can be aligned very well, and you can close up the surgery. One complaint that a few surgeons do complain about, sub 2 millimeter injectors. You know, they might cause iris prolapse. But here the trick that I follow is you have an angle of 45 degrees and you'll never get a iris prolapse with a sub 2 millimeter injector. So I worked with a surgical company and I designed this instrument, and ever since I've been using it, I would say my learning process was rough and patchy when I was using the routine irrigator. But ever since I've been using this, my results have improved, my surgical time has gone down, and it might also reduce PCO because it's flushing the posterior capsule very well. And it helps me get pristine corneas on post-operative day 1. So it's been a learning period for me, and thank you for your attention.